Okay, all right. So hello, dears. Ayan. So welcome to another pre-recorded lecture in your bacteriology class. And actually, you happen na gyud ta mahuman, no? Gamay na lang gyud kayo mahuman na ta sa inyong bacteriology na subject sa laboratory, no? And we're still on the process of continuing with our lectures on the different specimen collection, handling, and processing for your different specimens, okay? And for this lecture, what we're going to discuss is sputum culture. So how do we culture sputum? So inyong luwa, all right? So sa Bisaya pa luwa. So again, this is for sputum culture. Okay. So before we start with the sputum culture proper, we'll of course run through some terms, no, some mga diseases and pathogens also that may be isolated from your sputum and those that cause disease. And what are these diseases also? All right, so again, we'll start first with the respiratory system. So of course, very basic na review na ni sa inyong anatomy, no? So your respiratory system, you have the upper respiratory tract and the lower respiratory tract. Now, the upper respiratory tract na mention na nato during the throat swab na culture. Okay, so katong throat swab na culture, we were mainly focusing on upper respiratory tract pathogens, all right, and how to process that. Now, for sputum, what we're going to focus now is the lower respiratory tract. So more on the trachea, bronchi, and bronchioles, all right, that terminate now into the alveoli, all right? So again, from kaning larynx or pharynx, throat until diri sa taas, the upper respiratory tract. So na-mention natin na sa throat swab, no? And for now, for sputum culture, we're focusing now on the lower. So kaning mga trachea, no, your windpipe, the bronchi, then the bronchioles, and finally your alveoli, all right? Okay, so that's for the lower respiratory tract. Okay. All right. Now we go to the lower respiratory tract infections. Now these infections occur when the pathogens usually nagikan sa air, all right? Kaya na-bypass niya ang mga barriers nato sa upper respiratory tract, no? Nakalapos kid siya dito. Nabot siya sa ato ang pulmonary parenchyma and which now leads to the infections, all right, of the lower respiratory tract. Now, what are these infections? They may result from, again, inhalation of the infectious aerosols, obviously, because, again, this is the respiratory tract. So, mainly, the way we get infections is from inhalation, good, all right? Next is aspiration of oral or gastric contents, like kanang makalita kang suka or kanang murag machoke ka, yes, or kanang murag kasukaon ka, nya maabot imuhang or kanang matukan ka, yeah. Nayo ba na imong oral or gastric contents maabot sa imong lungs, all right, which can cause again these infections. And next is hematogenous spread. So if disseminated ng infections, of course, from the blood, maabot siya sa imuhang lungs, okay? All right. Yeah. Now, what are these infections? Okay, we'll run through these infections, no, ilang descriptions. So you have bronchitis or bronchiolitis, community-acquired pneumonia, nosocomial pneumonia, aspiration pneumonia, chronic pneumonia, and last is empyema. All right, okay. So first is, of course, bronchitis, infection of the bronchi, katong inyong bronchial tree, right? The bronchial tree padulong na sa yung alveoli, right? Again, review sa inyong anatomy, bronchitis, inflammation of the bronchi. Bronchiolitis is inflammation of the smaller diameter, bronchioles. All right. Busog na busog. Okay. So, it's a term reserved now for infectious disease of infants. Okay. So, bronchiolitis. So, bronchiolitis, inflammation of the bronchioles. Okay. Next is pneumonia, inflammation again of the lower respiratory tract involving the lungs, airways, and supporting structures. Usually, common na kayo ng term na sige, balik-balik o ingon, pneumonia and all that. When you say pneumonia, again, lower respiratory tract infection. Okay? All right. Community-acquired pneumonia, by the name itself, nakuha niya ang disease or ang pneumonia or ang cause ng pneumonia from the community. So from the surroundings na kung asa siya nag-live or kung asa siya na-expose. Alright? Yes. And wala sa outside of the hospital setting. So muna siya. Community-acquired pneumonia. And if I'm not mistaken, community-acquired pneumonia, ang pinaka-common ana cause is strep pneumoniae. Alright? S. pneumoniae. The most common cause of community-acquired pneumonia or CAP. CAP. Alright? If I'm not mistaken, ha? Alright, so Streptococcus pneumonia. Okay. Pneumonia. Alright, okay. Next, nosocomial. By the name itself, basta gani nosocomial ang term, guys. It means the patient acquired it from the hospital. So kanang na-admit siya. So example, na-admit siya o diarrhea or something like that. Then nagka-pneumonia siya after a while. So that's what you call nosocomial pneumonia. Nakuha niya from the hospital, nosocomial. Basta ang term na nosocomial, okay? Nosocomial, it means hospital acquired, okay? Ang meaning sa nosocomial, okay? All right. So nosocomial pneumonia, nakuha niya, or is like an example kanang gikag surgery, nag-recover, and then after a while kay padulong na siya sa recovery, nagka-pneumonia siya, inana. So, it's hospitally acquired or nosocomial. Alright. Okay. Next, you have aspiration pneumonia. It's basically pneumonia due to the aspiration of abnormal entry of fluid, particulate substances, or upper airway secretions into the lower respiratory tract. So, na yung fluid na involved. It could be from foreign fluid siguro in terms of bahasin kanang na tukan ka or na ingest ba na something, basta na aspiration of fluid. Alright, so aspiration pneumonia. Next is chronic pneumonia. Padayon gyud ang pneumonia, no? It's slow to resolve or inherently slow in progression. So it could be that could be example tuberculosis, no? Mga caused by pneumonia caused by mga anaerobic bacteria, could be or other kanang infections na pwedeng pang long term, okay, no? May pang infections kay long term in yung relationship. Char. Kamusta? Check ara. So long term, dugay siya maulian, dugay po siya wala kay siya na naulian gyud or wala siya na resolve, all right? So example na tuberculosis or mga fungal infections, fungal infections sa lungs. All right, okay. And last is empyema. Empyema is na kananay tubig sa imong lungs, alright? So naanay purulent fluid in an existing body cavity, especially the pleural space between the lung and chest wall. So because of infection, like example, chronic ba na infection, naanay fluid na accumulate, and this fluid is usually purulent. So naay mga pus na nadira, naanay mga dead cells, white blood cells, and bacteria pod, alright? So empyema, there's a fluid na in the lungs, alright? Or in the space between the lungs and the chest wall. Ayan, alright, empyema. Okay. All right. Okay. All right. So again, those are just some a run through of some diseases sa lower respiratory tract. Okay. Now we now go to the most common pathogens or agents of lower respiratory tract infections, and we divide them by age, okay, and etiology. So kanina age kinsa tong possible na pathogen. So first one is for neonates. Ang possible good is Chlamydia trachomatis. Now, Chlamydia trachomatis is a sexually transmitted disease. Now, nganong nasa neonates? Because again, pwede na what if the mother has chlamydia, alright? And then pagpanganak, okay? So, the baby passes through the birth canal, and what if na dito ang chlamydia? So, nakuha sa baby ang chlamydia, alright? So, therefore, leading to pneumonia, alright? Or other infections. So, neonates, Chlamydia trachomatis. For children, first is infants, so medyo mga babies pa. Usually viruses, RSV, respiratory syncytial virus, and influenza. For 5 to 18 months, so about a year old, strep pneumonia and Haemophilus influenzae. Haemophilus influenzae. And 3 months to teens, it's about still viruses, Staph aureus or strep pneumoniae. So as you can see, ang strep pneumoniae, it's always there. Okay. Ayan. Now for young adults, akong age, I'm still part of that, ha? Ka-age ko lang kayo. I'm still 21, char. Okay, Mark, whatever. Mycoplasma pneumoniae, all right? We'll talk about Mycoplasma pneumoniae later, all right? For older adults, still strep pneumoniae and Legionella species. And for institutionalized adults, like kanang nasa hospital or kanang, nasa mga institutions, you have Gram-Negrods, okay? Pwede ato mga Enterobacteriaceae, strep pneumo, and Staph aureus. All right. So as you can see, ang strep pneumo gyud ang siya na gyud ang winner sa all. All right, winner na gyud siya sa tanang winner. Okay, all right. So we'll now go individually to the following etiological agents, starting first with Chlamydia trachomatis. Now, kanang nasa araw ang chlamydia. Your Chlamydia trachomatis, mga good guys, I don't know if you can remember, and I think na-mention na po yung lecture. Chlamydia is part of the Rickettsia family, or same sila characteristics, that they are obligate intracellular. Alright? Obligate intracellular. Okay? So what do you mean by obligate intracellular? Obligate, kailangan gyud, alright? Intracellular, sulod sa cells. So kailangan gyud na naa sila sige sa sulod sa cells so that they can live. So basically, same sila og parasites, no? Actually, they are considered as obligate intracellular parasites, okay? Because they need to be inside cells, alright? So very characteristic of inana, no? Dili sa same og parasites there. Same sila og viruses. sorry. Obligate intracellular parasites ang name nila, but they have the same characteristic with viruses in that they need to be inside cells to live. Alright? Okay, if wala sila dito, di sila mo proliferate, di sila mo live. Okay? So that's an example of chlamydia. Inana sila. Chlamydia, rickettsia. Okay, kana sila. Alright. Now for gram stain, they don't usually gram stain well, but if they have to be gram stain, or ilang reaction sa gram stain is gram negative. And chlamydia has two kanang forms. Okay, you have number one is the elementary bodies. Okay, and this is the infective form. And you have the reticulate body. Okay, which is in a way the parang replicative. Okay, o parang iyahang dormant form. So this is the form na kanang sa sulod na sa cells para mo replicate siya. The reticulate and elementary body. So walay high school, charot lang. Alright, so ang elementary bodies ang infective form sa chlamydia. Alright, so muna mo spread. Okay? So again, gram-neg bacilli daw sila if na mo gram stain, but generally dili sila mo gram stain well. Alright? Culture, again, unsa to ang culture media of choice for chlamydia. Recall pa? Sa culture media prep, the culture media of choice for chlamydia, nako press the buzzer, sino yon? McCoy cells. Alright. McCoy cells. Wala lang na-mention dira, but McCoy cells. Okay? Alright. Now, again, chlamydia, as mentioned, it's primarily a sexually transmitted organism. So, makuha siya through sex. But again, as mentioned, ang infants, pagpanganak or neonates, muagi sa birth canal. Now, what if ang mother na ay chlamydia, so makuha sa baby ang chlamydia. Alright? Hence, resulting to infections. Okay. Now, again, aside from that, you have also trachoma, which is sa eyes, all right? Lymphogranuloma venereum, which is parang a lesion that starts in the genitals, and then dito na nag-start infection, all right? And inclusion conjunctivitis, still the same sa mata, all right? Principal cause of pelvic inflammatory disease, so kana sa females usually, so maabot siya sa diri basta pelvic inflammatory, maabot siya sa pelvis, basta diri dapit na inflammation. And intraperitoneal spread and may lead to peritonitis, okay, and perihepatitis, so inflammation na of sa surrounding sa liver, okay, and can be associated with infertility and ectopic pregnancy. So muna siya guys, no, for sex good, you can acquire a lot of diseases. So please make sure to check your specimen. All right, no kidding, just practice safe sex lang good. And examine your specimen. Always good. All right. Ganun yung mga telltale signs sa ilahang mga organs dyan. So, mas okay na. Better to be safe than sorry. Okay. Alright, ayan. Okay, that's for Chlamydia trachomatis. Next, for Streptococcus pneumoniae. Again, so sige nagbalik-balik, no? Gram-positive, cocci in chains, lancet-shaped. Okay, lancet-shaped, diplococci ni sila. Again, characteristic alpha hemolytic, mucoid, and na depressed centers. Okay, so na siya buho or na siya depression sa tunga. Okay, on BAP. Again, catalase neg, optokine, di ba? Taxo P, sensitive, and bile-soluble. Defining characteristic, optokine, bile-soluble. Okay. Alright. And again, also known as the pneumococcus, S-pneumo, lobar pneumonia. Ayan. Lobar pneumonia. Alright. Lobar pneumonia meaning ang lobes good sa lungs ang naapektuhan. And it has a characteristic sputum known as rust-colored sputum. Ayan, please take note. Strep pneumo. Rust-colored, na murag nanimahong taya or murag taya yung itsura or yung smell pod. Alright, rust-colored sputum. Most common cause of bacterial, pneumonia in the elderly and immunocompromised. And the most common cause of bacterial meningitis in adults. Yes, ang strep pneumo. Okay, alright. So yeah, for strep pneumo, just again, nagikan na taan na no, na kabalo na ta sa biochem. So review na lang, hopefully. Okay. Next, you have Haemophilus influenzae. Again, pleomorphic coccobacilli requires both the X and V factor. On chocolate agar, on sa iyahang colonies, mucoid, alright? Tan-colored translucent, and on sa iyang odor, mousy or bleach-like. So, nanimaho siyang daga or bleach, nanimaho siyang bleach. Okay. Alright. Next, you also have biochem, catalase positive, oxidase positive, and of course, X and V factor requirement. Okay, all right. And of course, H. influenzae yung other name, Cockweeks bacillus. Fastidious capnophilic, main cause, ayan, mura dyan siya, main cause of meningitis in children. Now, muna siya guys, if naka-ano mo, if gana mo as yung parents, you have the HIB, okay? HIB ha, dili HIV. HIB vaccine, okay? Now, what does the HIB vaccine means? H. Influenza, influenza, serotype B. Okay? Ayan. Muna siya ang HIV vaccine. Now, kids usually kita, ako kaasa akong parents, pero we have this vaccine because again, this serotype sa H. influenzae ang usually ang pinaka-virulent na serotype and may makakause sa meningitis sa children. That's why kailangan tawag HIV vaccine, HIV. Okay, ang meaning sa HIV, Haemophilus influenzae serotype B. Ngano? Because it's the serotype that usually causes the most virulent, or it's the most virulent na serotype of H. influenzae. Okay? Alright, so that's for H. influenzae. Alright. Okay. Ayan. Next, you also have your Staph aureus naman, of course. Gasgas na gasgas, popular na organism natin. You have, of course, clusters, beta hemolytic, golden yellow colonies, or buttery, no? Catalase positive, bacillus resistant, modified oxidase negative, glucose fermenter, and of course, coagulase positive. True coagulase di siya, Staph aureus. Again, ang S. aureus magod usually mga skin or wound infections na siya because again, normal flora of the skin. But because of mga hematogenous or pwede siyang ma-spread pod, no? It can cause also mga lung infections. Okay, alright. Next, we have what we call Mycoplasma pneumonia. Now, I'm not sure if you can still remember po sa intro to micro, but I have introduced Mycoplasma. Mycoplasma, together with your Anaplasma, okay, Anaplasma and Urea plasma, these are all your, I think pala ni siya. Kaya lang, Mycoplasma, Urea plasma, these are all your cell wall, ayan, deficient bacteria. Okay? So, I don't know if naka-recall pa, Mycoplasma, Urea plasma, these are again, mga walay cell wall. Okay? Wala sila cell wall. Therefore, dili sila gram stain. Okay, Mycoplasma pneumonia. Alright, okay. Now, for Mycoplasma pneumonia, culture ni mo siya on sp4 agar, sucrose phosphate. So, mga specific na culture media. I'm sure I discussed that sa lecture. Okay? And it's, pinaka-important lang to remember about Mycoplasma pneumonia is that it causes your primary atypical pneumonia, PAP, or walking pneumonia. Now, what do you say walking? What do you mean by walking? Walking pneumonia is you have the pneumonia, but you don't feel it. Or like, dili kayo na naka-showy ang symptoms. Pero you have pneumonia. Okay? Kagets mo? Muna siyang walking pneumonia. Kaya like, the patient is doing fine. Okay? And pero, wala siya nag-exhibit of any symptoms na murag to the point na ganahan na siya magpa-hospital, inana. So murag makayarag sa balayra, mga inana ba, bed rest lang and all that. But di ito na siya pneumonia. That's walking pneumonia. Again, causative agent, Mycoplasma pneumoniae. Alright? Please take note. Okay. Alright. So inhalation of contaminated aerosols and pwede po siyang, ang PAP daw pwedeng mahimong outbreaks. Okay. Alright. Okay. And next, you have Legionella pneumophila. Alright? So Legionella, one of fastidious gyapon. Faintly staining and gram stain. That is why, gani, di ba? Unsa to atong chika anang Legionella. Unsa atong counter stain dapat na gamiton, instead of safranin, you have 0.1% fuchsin. Alright? Para mas makitaan siya. So what is a counter stain that can be used to visualize Legionella or Legionella better? 0.1% fuchsin. Okay. Alright. Ayan. So again, iyahag culture medium of choice, you have BCYE, buffered charcoal yeast extract agar na naay cysteine. Alright, so appeal siya sa mga kanang Francisella, Legionella, Bordetella ba? Appeal bang Bordetella? Pasturella, may mga ella na kailangan og cysteine. Okay, please take note. Pero kanang cysteine usually sa Francisella ginang kailangan jud siya. Okay, og cysteine. Okay, please take note. Alright, ayan. Okay. And biochem, catalase positive, gelatinase positive, and weakly oxidase positive. Now, for Legionella magud guys, usually, it doesn't grow well on culture. Alright? So, usually, atong ginabuhat na lang is serological test stuff for Legionella. Okay? Alright. Ayan. So, again, causative agent of Legionnaire's disease, which is Legionellosis, pneumonia-like, and Pontiac fever, allergic disease siya, but na symptoms of pneumonia. So, for Legionella pneumophila, you have Legionnaire's disease and Pontiac fever. Okay. Now, what is the one thing that I want you to remember for Legionella? Asa siya ma-isolate? Mga air conditioning units o cooling towers, humidifiers, and nebulizers. Usually, mga inanag yun na questioning sa case studies, no? Again, clue ra gyapon na siya sa identity sa imong organism. So, example, questions kay na-isolate siya from an aircon, from a cooling tower, etc. Nag-exhibit og mga symptoms of, kanang pneumonia-like symptoms, then that could really be Legionella. Okay? Alright, so mga clues lang. Alright? Please take note sa mga diseases na yung ginakos, Legionnaires and Pontiac fever. Okay. Pontiac Bandit. Okay. Ay, wala mga Brooklyn Nine-Nine fans. Anyway, alright, okay. Ayan. So for, okay. Now for, before we end on this first parts of video, we'll start first with specimen collection for sputum. So, of course, sputum is the commonly collected specimen. But according to Ma'am Teddy, and as far as I've known also, anas Ma'am Teddy, dili na jud kayo refer ang sputum for culture. Why? Because again, sputum is luwa, no? So, what you're trying to get is lower respiratory tract. But, ang nakapan mo sa sputum is moagi siya sa mouth, okay? And your mouth is, contains a lot of normal flora, which could, be external contaminants, okay? That could really hinder your analysis. But again, sputum magod is still ginagamit because again, it's really accessible, dali ra po siya kuwaon and convenient for the patient, okay? And it's, it's commonly collected na specimen. Early morning specimen, deep cuff yun dapat. So muna siya usually para sa AFB, no, sa SOTA ako na experience, like 50, my God. Usa ka morning shift ra na ha, from 7 to 2 p.m. My gosh, 50 or to 100. No, na patients na sputum niya, each patient duha ka sputum. Imong i-stain for AFB and ay uban nila na culture. Oh my gosh, so na siya kadaghan. As in like whole morning shift nimo, mura nimo baton magkutaw-kutaw kag sputum guys sa SOTO. All right, ako na experience. All right. But yeah, early morning deep cough. So usually atong instruct sa patient is, 'di ba, deep breaths twice and then ang ika-third na deep breath, mubo na siya appeal. So para in a way that will get murag deep mga diri sa lower respiratory tract, okay? Early morning, wide mouth, sterile container. As much as possible sterile. Sputum, again, not the specimen of choice for diagnosing bacterial pneumonia because again, of the reason that it passes through the mouth, which contains a lot of normal flora. Okay? Alright. Responsible pathogen, it's not determined in as many as 50% of the cases. Why? Because pwedeng, again, naagi sa mouth, daghang contamination. Aside from that, sa pag-collect mismo, what if ang patient kay, igorang ni, wala dyan ni deep cough, like, diretso ragluwa, inanaba, like salivary, ang sputum. So, it's not really diagnostic, di ba? Alright. So, therefore, ang best specimen ko na to is blood and bronchoalveolar lavage. Kaning bal, lumabas sa boards. Unsay meaning daw sa bal? Oo. Later. Unsa day na type of specimen ang bal? Respiratory specimen. And unsa daw ang best specimen for lower respiratory tract for bacteriology or for microbiology? Bal. Please take note. Bronchoalveolar lavage. Okay. Ang point ana is, invasive procedure noon, like, nai-insert na instrument na mabot sa mga bronchios and then kuwaan og sample dito. Alright? So muna siya ang bronchoalveolar lavage. Okay. We'll discuss this later. Alright. No single test that available can identify all potential pathogens. Never be misled. Again, as mentioned, URT, mouth, normal flora. And be wary of, kinsa ni, Cleb pneumo, which causes pneumonia in patients with, kinsa, ventilators, which is a nosocomial infection. And ang characteristic daw na sputum ni Cleb, currant jelly. So muna siya kanang sa jelly ace daw na sputum. Currant jelly. Okay, please take note. Characteristic sputum for Cleb pneumo. Okay, alright. And transport at RT within 2 hours and process promptly and pwede siyang ma-refrigerate if delayed. Alright.